Fang Fang, Wuhan Diary, dispatches from the original Epicenter. In this gripping summary of Wuhan Diary, dispatches from the original Epicenter, readers will be transported to the center of the coronavirus outbreak through the eyes of author Fang Fang. As a longtime Wuhan resident, Fang details the initial confusion, chaos, and fear that gripped the city as the virus quickly spread and the government struggled to respond. Readers will learn about the challenges faced by those living in quarantine, intense pressure on healthcare professionals, and the community's efforts to support each other and bring hope during the darkest of times. Experience the heart-wrenching first-hand accounts and realizations about the importance of working together to overcome a global crisis.
The early days of the coronavirus outbreak in Wuhan. Fang Fang, who has lived in Wuhan for over 60 years, gives a personal account of the early days of the coronavirus outbreak, weeks before much of the world knew about it. Despite rumors and videos circulating online, the government downplayed the severity of the situation until a specialist made a public statement describing the virus as not contagious between people, it's controllable and preventable. The media followed the government's assessment without critique, and it wasn't until infectious disease specialist Dr. Zhong Nanshan revealed the virus could be transmitted between people that the severity of the situation was apparent. The government ordered a complete lockdown of the city beginning on January 23, leaving Fang Fang and 11 million other Wuhanese stuck at home for weeks. Fang Fang chronicles Wuhan's lockdown. Fang Fang, an active user of social media, documents her 76-day quarantine experience on Sina Weibo, the Chinese Twitter equivalent. She shares her journey with followers as the streets of Wuhan lie deserted and fears and tensions rise. With no traffic running, patients walk to the hospitals, only to be turned away as there is not enough staff and resources. The government's unpreparedness and hasty response caused much suffering, especially for those who could not work or leave the city. Fang's diary sheds light on the woes and struggles of the people of Wuhan during the pandemic. Rising together. As the outbreak in Wuhan peaked in early February, the citizens of Wuhan grew optimistic. They found new and unexpected ways to help one another, from using social media to deliver food and supplies to older residents. Their sense of community led to the opening of temporary hospitals throughout the city and the arrival of aid from Japan and Pittsburgh. The medics shared good news that people with mild infections were recovering quickly, and American drug remdesivir offered new hope for serious cases. Through this crisis, the people of Wuhan rose together and showed the power of compassion and resilience. Growing restlessness amidst the pandemic. As the lockdown in Wuhan continued, the infection rate slowed down, but people grew restless and began demanding answers from the government. The outbreak also posed several questions for the officials and scientists alike, from the slow acknowledgement of contagion to the unpredictable nature of the virus. The frustration peaked with the news of Dr. Li's death, whose profile page on a networking site became a platform for expressing discontent and anger. Despite low-ranking officials being fired, no one in the Chinese government took responsibility for the mishandling of the outbreak. Fang Fang's online diary. Fang Fang, a Chinese writer, used her online diary to express her concerns about the government's response to the pandemic. As her diary became popular, Fang became the target of censors and online trolls. She was used to censors taking down her online posts or temporarily suspending her social media accounts. However, the attacks of online trolls intensified as Fang refused to back down. Despite the online attacks, she continued to write on her online diary, voicing the questions and concerns of people around her and adopting the motto, "Don't leave the world in the hands of the bastards." Slow recovery and secondary disasters. Despite the strict lockdown in Hubei and its capital, Wuhan, it took a long time for the coronavirus infection rate to decrease. The delayed response resulted in many infected people not receiving treatment in time. The virus also infected hundreds of healthcare workers, and entire households were destroyed. The strict quarantine caused economic concerns, with many people losing their income, especially peasants and migrant workers who had nowhere to go. Fang, a Wuhan resident, urged officials and volunteers to help the weakest members of society and suggested financial aid for citizens and an army of therapists to ease the psychological stress and trauma of the pandemic. The joyful end of a lockdown. In March, 45 days after the lockdown in Wuhan began, the first signs of improvement surfaced. With fewer than 100 new cases and the virus under control, the city of Wuhan gradually lifted its lockdown. The people's lives started returning to normal, but the government's advice remained the same: practice social distancing, wash hands, and wear face masks. In her final diary entry, Fang commended the people of Wuhan for their bravery and persistence and saw the crisis as a lesson for China. On April 8, after 76 days of being stuck at home and stressed, the people of Wuhan were finally able to return to their lives.
As the summary of A Wuhan Diary, Dispatches from the Original Epicenter, comes to an end, readers are left with a sense of hope, sadness, and the power of community. Although the residents of Wuhan faced immense challenges, they demonstrated resilience, bravery, and cooperation throughout the 76 days of quarantine. The author, Fang Fang, brings to light the shortcomings of both the Chinese government and Western reactions, emphasizing the need for a unified global response to such crises. Through her account, readers are reminded of the importance of helping each other in times of need, and the strength that unity brings in facing and overcoming seemingly insurmountable challenges.